Good afternoon, everyone. I'm so excited to talk to you all about something I'm very passionate about and a really important topic. Not only is what we're going to discuss important as you age, but it's important to learn this information to help those around you, whether it be friends, family, acquaintances. Today, we're going to discuss what a carotid ultrasound screening is and why it is important. The carotid artery is located in your neck, and you have this on both sides of your neck. Radiology Society of North America lets us know that this ultrasound uses a Doppler that uses high frequency sound waves that travel from the Doppler, or they also call it a probe, through the gel that they place directly on your skin, and in this case would be both sides of your neck. What it is doing is it's checking your blood flow and seeing if you have any type of plaque or stenosis blocking the arteries. The risk associated with carotid plaque, or in other words, stenosis, is stroke and atherosclerosis, which, according to Mayfield Clinic, it is a disease of the arterial blood vessels in which the walls of the arteries become thickened and hardened by plaque. This is also called hardening of the arteries. The reason providers offer this screening is that the carotid artery plaque is a silent disease that you really don't know that you have unless you get this study done, or unfortunately, you end up having a stroke caused by the blockage. As we move on to the next slide, we will go into more detail as to how the ultrasound is performed, indications to get this done, and what exactly the providers are looking for. Ultrasounds are non-invasive and safe and pain-free. Radiology Society of North America explains that the ultrasound is performed with a Doppler or a probe, and it is also used with ultrasound gel. This is how the sound waves are made. Without the gel, you would not get any sort of picture or any sound waves in order for the sonographer to have that come up upon her screen. There's absolutely no radiation used in this test. This is a pain-free exam that has no discomfort from the probe pressure against the area being examined. When you get this exam done, you can oftentimes hear a whooshing sound, which is actually your blood flow. So it's pretty neat to watch and listen to if you were to get this done. For this type of screening exam, the sonographer is strictly looking on both your carotid arteries for any plaque or stenosis. These things increase your risk for stroke. There are other risk factors that a provider could order this exam for, but for a screening, this is something you would ask for yourself. If there is any plaque or stenosis, a treatment plan would be initiated to help avoid stroke. Sometimes they'll do medication. Usually, you would have some changes in your diet, add some exercise into that as well. Radiology Society of North America gives a list explaining what risk factors could initiate this exam, such as diabetes, elevated cholesterol, high blood pressure, family history of stroke or heart disease. All could be reasons to get this exam. You, as the patient, have the right to ask for this exam, and you do not need a diagnosis for this screening. That's why it's called a screening. If I could get you to focus your attention to this next slide. Mayfield Clinic defines carotid stenosis as the narrowing of the carotid arteries. The carotid arteries are the two major arteries that send blood from the heart to the brain. This is also called carotid artery disease. When this becomes narrow, it blocks the blood flow to the brain, which then can cause stroke if the blockage is large enough. There are usually no symptoms of carotid stenosis. In our clinic, I have described this to our patients as a silent disease. You really have no idea that this builds up unless you were to get the ultrasound, or if it gets, unfortunately, to the level of stroke. Mayo Foundation for Medical Education and Research defines a TIA as transient ischemic attack, which is a mini stroke. Causes of carotid stenosis is atherosclerosis. Mayfield Clinic explains this as it begins to damage the inner wall of the artery, and that is caused by high blood pressure, diabetes, smoking, and bad cholesterol. The suggested age for this said screening, the carotid artery screening, by Dr. Kimberly Freeman at Mid-South Internal Medicine in Germantown, Tennessee. She recommends if you're over the age of 40 and or have any of the previously mentioned diagnoses. There is no reversing plaque in your arteries. What can be done is diet, medication, and rechecking every year to ensure that this isn't progressing any worse and that the provider that you see is able to keep this in control. To help avoid the seriousness of the plaque buildup, it's important to eat a healthy diet, make better choices, choose lean meats and vegetables, whole grains and fruit. Just a few of these changes can help you along the way of your health. What I have with me as well is, I have this model here. This is actually a model of the carotid artery. This is what your carotid artery looks like if it's normal. There's no plaque, any kind of blockage there in this first one. This second one here, this is fatty deposit. So this is mild plaque. This is what they're looking for. If you have any initial starts of any carotid plaque, stenosis, this is where it begins. And this is where we can get ahead of that stroke and the TIA. The further it gets along, if this goes untreated or if the patient doesn't know the seriousness of what their arteries look like, this is vulnerable. So this is pretty severe plaque. It gets up here into the rupture where it has ruptured through the artery. And then these are the three worst ones. This is where it's leading straight to the stroke. Complete blockage here, heart attack, thrombosis. It's a really cool little model. Okay, with all of this clinical information that you are aware of now and the importance of this, let's discuss the big factor that many people consider into doing the initial screening ultrasound. Please view this next slide. Cost. This is something that is asked about when we offer this screening ultrasound at our office. The cost for this typically runs about $80. And if your ultrasound comes back abnormal, your insurance will cover this every year, usually after a wellness visit. They'll check it every year to make sure that it hasn't gotten any worse and that the medications that you're on and the lifestyle changes that you have done are really helping that artery so that it doesn't get blocked. There are a few different tests that you can do to see your carotid artery. However, both of these are not cost efficient and contain radiation exposure. With ultrasounds, there is no radiation and it is a non-invasive test. Stephanie Mullins, who is a registered medical sonographer, explains that ultrasound as also giving you a velocity, which correlates to the percentage of the stenosis that you have. And it also shows the direction of the blood flow, in which an MRI or a CTA, neither of those do that. So ultrasound is not only radiation-free, pain-free, it gives you better numbers and a better look at your percentages and your velocities. The other negatives with MRI and CTA are they are both very expensive, ranging from hundreds of dollars that's come out of your pocket if your insurance does not cover it, or if you're subject to your deductible. A CTA includes radiation exposure, which if you can avoid any radiation, that is always the best option to choose. All in all, ultrasound is the most efficient way to take a look at your carotid arteries for a small price of $80. $80, which could ultimately change your life. Direct your attention to this final slide, please. Screening carotid ultrasounds are important. This is something that I've seen change people's lives forever. People who come in thinking that they have no health issues in the world and end up having a severe blockage and having to go for surgery to get that stent put in. I advocate this screening to my patients daily who are surprised when they discover that they indeed have some level of stenosis. There is a chance to prevent yourself from having a stroke and really endangering yourself by just getting this done, having this screening done, this preventative exam. You can be put on the right medication, and easy changes within your diet could take you a long way. Americans today eat poorly, and that's just how it is these days. And we don't take the best care of ourselves. That's why this screening can really help someone and potentially save a life. I hope that this has given you all a better explanation what a carotid ultrasound is, and I hope when it's important to stay healthy, and I hope that when you're reaching that age group 40 and up, or if you have any of those risk factors, that you get this looked at. Thank you.